Hi, my name is Dr Ayesha Verrall and I'm an infectious diseases physician and epidemiologist at the University of Otago. Today I want to talk about three things in 3 minutes: our move to level 2, face masks and asymptomatic transmission. And it was announced that we'll be moving to alert level 2. This was greeted with a lot of delight in my household, where our 6-year-old is really looking forward to going to school. As you know, there's been cases in the single digits and sometimes 0 in New Zealand over the last couple of weeks that we've been at alert level 3. And the cases that we have had have been connected to known cases or to overseas travel. There's been no hint of community transmission for several weeks now. So that's really reassuring. Also during this time, we've really lifted our contact tracing and our testing capacity. So that's really our insurance against having to go back into level 3 or 4 again. But level 2 isn't normal life, and it's actually there's still important things that we have to do, like washing our hands and cough and sneeze etiquette and maintaining our distance when we're out in public spaces. And there's also going to be a staged reopening of many businesses. So restaurants will open before bars, schools will take until next week to open. And there's a cap on gatherings. You're only allowed to have 10 people initially at your house for a party, which was a restriction I did not predict, and now I have to uninvite 2 guests from my party in 10 days' time. So a job for me to do later on. I also want to talk about face masks because they've been quite controversial, and I think it's quite poorly understood what a face mask does for members of the public. So when you make your own cloth mask, which is what's proposed because we don't have enough surgical masks to give to the public, when you make your own mask, it doesn't protect you. It prevents you from transmitting to other people. And really importantly, you still, even if you have a mask, need to stay at home. So if there's a function of cloth masks or homemade masks, it's to prevent you from transmitting to someone else in the time before you develop symptoms, the couple of days of risk where you can do what's called pre-symptomatic transmission, so prior to developing symptoms, transmit the virus. I think there's no evidence that this works, but it has been used by countries who have successfully contained the virus, along with a suite of other measures. I guess at the end, it comes down to a risk management decision. And I think one of the most reassuring things about New Zealand is we do have really low rates of transmission in New Zealand, lower rates than in Korea, lower rates than in Singapore, where they've been used, and definitely lower than the UK, where masks are being recommended for use on public transport. So in that situation, I don't see any evidence strongly in favour of using masks on public transport, for instance. But if there was higher rates in the future, and we did have to do as the UK is doing, reopen when there are high rates of transmission, that might have to be part of the package of measures you put in. Another thing is I think masks distract from a really important measure, which is hand washing, and especially for pre-symptomatic transmission, because I think a lot of that is probably not coughing or sneezing because it's pre-symptomatic, but touching your face and contaminating the environment. So I'd prefer to see an emphasis on that rather than mask wearing. Thirdly, let's talk about asymptomatic transmission, because we're testing a lot of asymptomatic people in New Zealand because we're running out of symptomatic people to test. Don't tell people in other countries, they'll be so jealous of that problem. So with asymptomatic transmission, there are definitely people who have COVID and no symptoms. And I don't mean people who are about to develop symptoms. These people that we're talking about never develop symptoms. So one of the controversies in the medical literature is not that they exist, but whether they're capable of transmitting. And when you look at countries that have controlled the virus mostly through what we call case-based measures, so finding and isolating people who are symptomatic and tracing their contacts, they can't possibly work on stopping asymptomatic transmission. And yet these measures control the outbreak. So it's quite likely asymptomatic transmission has a reproductive, asymptomatic cases are not capable of transmitting as efficiently as other people. In fact, the R value, the capability of them transmitting, is probably less than 1. But we don't know that for sure. So what we need to do in New Zealand, now that we are doing a lot of asymptomatic testing, is it really puts the onus on us to find out the answer to this question, to trace all the contacts of any asymptomatic positives that we find and see if there's been any transmission to them, and then try and quantify it. We're probably one of the few countries in the world that can address this question right now. We're not going to be able to get the answer from studies done in the UK or the US. And we will need the answer in the future when we continue to have this elimination strategy and low case numbers and moving down alert levels and wanting assurance there's nothing going on. In the end, I imagine we're probably going to find that we develop a risk-based approach to asymptomatic testing, but it's really important we get the data to guide that strategy. All right, that's all from me tonight. You can find me on Twitter if you want to talk about any of these issues or anything else more. My handle's Dr Ayesha Verrall, and I'll see you here again in level 2. Good night.